I'm Dr. Basavaraj Biradar, Consultant Interventional Radiologist at Narayana Health City, Bangalore. Uterine fibroids commonly affects women of young age group or a reproductive age group. Uterine fibroids are benign, non-cancerous growths occurring in the uterine wall. Basically, they are overgrowth of the smooth muscles in the uterine wall. The symptoms of these uterine fibroids include increased menstrual bleeding, pain during menses. They are also responsible for the pressure symptoms like pelvic pain or increased frequency of micturition or constipation. They are one of the potential cause of infertility. Initial therapy for the uterine fibroids is through a medical conservative management, either through hormonal therapy. If it doesn't subside, the earliest standard of care was through surgical approaches such as myomectomy or a hysterectomy where the uterus is completely removed. But the uterine fibroid embolization has taken a versatile approach in treating in a non-surgical or a minimally invasive approach where there are no cuts or no incisions, and the procedure doesn't require a general anesthesia or a spinal anesthesia, which is usually in the case of a surgery. Entire procedure is done under local anesthesia with adjacent pain medications. Uterus has got a blood supply from the uterine arteries on either side of it. So this process takes advantage of this blood supply where the fibroids predominantly derive the blood supply from these uterine arteries. Through a groin, we put a small catheter, it's around 1 to 2 mm catheter, through which we access these uterine arteries which are supplying the fibroids. And by superselectively, we inject microparticles called as polyvinyl alcohol particles, which block the blood supply to these fibroids. Once the blood supply is cut off, the fibroid gradually shrinks over a period of time. The symptoms such as increased bleeding and pressure symptoms improve gradually. This uterine fibroid embolization is a safe, proven, effective treatment. Virtually no blood loss, no scars, no requirement of general anesthesia or a spinal anesthesia. The entire procedure is done under local anesthesia with minimal adjacent analgesics, and the uterus is preserved. If you are experiencing any of these symptoms, you can ask your doctor for uterine fibroid embolization as one of the treatment modality.